to have the ability to create the kind of social and economic agenda that lifts up America. So, you know, if we stay riveted on this healthcare debate and don't get out of it at all, we've actually created kind of a prison here of our own making. And so I don't want to be a party to that. You know, I have taken the debate as farther than anybody else who opposed this bill and who had held the positions that I've held about single payer. Yes.
Congressman Kucinich, earlier you had said, and when Sabrina was asking whether there were any concessions that you received, that that wasn't the conversation, that wasn't what your conversation with President Obama was about. But I'm not clear as to whether
there was no Nebraska or Louisiana type deal.
So there's no like federal regulation, insurance regulation tweaks for Ohio or anything?
No, no. I mean, this wasn't about the kind of deal making that is essentially self-defeating towards the goal, and that undermines public confidence in a bill. You know, I've raised objections to those aspects that are in the bill, but that's not what my support is all about here. This is, you know, I come at it from a different level, which is taking a more historic, long-term view, and also looking at how can we empower our president and the Congress and the government to start to move the country forward. And you know, notwithstanding the differences we have, I reserve the right to continue to disagree on the elements in this, and we're going to keep working to reshape it. Was there a question in the back?
Yes. When did you tell President Obama that you will support the bill, and what did you tell him?
Just now.
Congressman, in this press
this morning?
Just now. I'll call the, you know, I have not formally contacted the White House. They're knowing right now. This isn't, just so you understand, this isn't some kind of a back and forth that was worked out. This is what I think, and the President, I assume, will be notified by his aides of this position. Did they ask me to support the bill? You know, you bet they did. I'm just been told I'm almost out of time, I guess. Who hasn't asked the question, and I'll go back to the next. Go ahead.
When you said that they would pledge to work with you in the future about some of your concerns, were there any particular pledges on particular areas moving forward, you know, corrections bills or anything?
No. We didn't get into that level of specificity. Yes. Who hasn't asked the question?
What do you say to your friends on the left who are going to say you just sold out?
Well, you know, my reputation is one that I don't buckle under pressure. You know, I've taken some positions that, you know, throughout my career that most people wouldn't want to take. And I'll continue to do that. And to me, this isn't about left or right. I approach matters in this Congress based on what I feel is right for my constituents. That some would want to put me in one category or another. That's, you know, that's up to them. The CQ has me at number 161 or something like that in terms of a liberal conservative index. But I will tell you that I'm going to continue to reach out and be available to answer questions about the direction I think we should go. And this is one moment in time that we need to keep moving and advancing from. Yes, you had raised your hand about 18 times. I don't want you to think that I had forgotten you a second time.
I hear you. Actually, I was wondering if you could switch gears just a second in regards to your conversation with the
Could you
President.
slow down with your question?
I was wondering if you could talk about, did you talk to the President about Afghanistan and about perhaps pulling troops out? Did you talk to him about that?
No. No. The only thing we talked about was health care. And I will tell you, I mean, look, we had a debate on Afghanistan that I appreciated the support of the Speaker in gaining. But you know what? The decision's made. We're going to be there. Do I like it? No. But that's not what this is about. Yes?
You've been very transparent in telling us that you're going to vote yes on health care reform. How do you feel about the D-man pass being used to get the Senate bill through in rulemaking?
About which impact?
The D-man pass?
Yeah, the process, look, I don't like much anything about this process, okay? You know, I don't. Yeah, if you're looking for somebody to give a blessing to the process, you're looking at the wrong person. I can't do it. I'm going to vote for the bill. Is that it? Are we out of time? We're out of time here. Nathan White is my press person, and he will be available to answer follow-up questions. And if you need to talk to me, he'll arrange that. I want to thank you for being here. And again, I think it's important that we have to be very careful that the potential of President Obama's presidency not be destroyed by this debate. And I feel, even though I have many differences with them on policy, there's something much bigger at stake here for America. And that's what I'd like people to think about. Thank you.
There are copies of the prepared remarks outside.
Congressman Dennis Kucinich of Ohio announcing he will vote for the health care legislation. He was one of